Welcome to our video on 6 common meds that can cause heart attacks. Did you know that some of the medications you might be taking could actually increase your risk of heart disease or even heart attacks? It's hard to believe, right? You're doing everything you can to manage your health, but the very pills meant to help you could be working against you. It's a scary thought, but don't worry. Your health is in your hands, and with the right knowledge, you can take control. In this video, we'll break down how these 6 meds can impact your heart, what factors put you at greater risk, and most importantly, how you can protect yourself and make smarter choices for your health. So, let's dive into our countdown, starting with the first medication. Did you know that some common cold medicines and stimulants, like those used to treat ADHD, can raise your risk of a heart attack if you're not careful? For example, pseudoephedrine, a decongestant found in many cold medicines, can increase your blood pressure and heart rate. There have been cases over the years where people have suffered a heart attack after using pseudoephedrine. One example is a report from 1990, where a healthy 28-year-old man had a heart attack after taking just 60 milligrams of pseudoephedrine. What's interesting is that when doctors checked his heart later, his arteries were actually fine. But it's not just cold medicine. Prescription stimulants containing an amphetamine salt mixture, which are used to treat ADHD, can also put stress on your heart. A 2024 study presented at the American College of Cardiology found that young adults taking these stimulants were 17% more likely to develop heart muscle problems, cardiomyopathy, after 1 year, and 57% more likely after 8 years, compared to those not taking them. That sounds scary, but keep in mind that the overall risk was still really low, less than 1% in both groups. If you already have high blood pressure or heart problems, it's a good idea to avoid pseudoephedrine and talk to your doctor before using any stimulants. Always check labels carefully and ask your pharmacist if a medicine is safe for you. Now let's move on to the next medication on our list. Number 5. Chemotherapy drugs. Some chemotherapy drugs used to treat cancer can damage the heart and increase your chances of heart failure or a heart attack. 2 common examples are doxorubicin and trastuzumab. Doxorubicin can be hard on the heart, especially if given in high doses. A 2012 study found that around 6% of patients developed heart failure after receiving a certain amount of this drug. It can cause direct damage to heart muscle cells, which makes it riskier as the dose increases. Trastuzumab, on the other hand, can weaken the heart by blocking certain pathways that help keep heart cells healthy, which can also lead to heart failure. The risk of heart problems goes up if these drugs are used together or combined with other medications that stress the heart. If someone already has heart disease, their chances of developing heart failure from chemotherapy increase even more. As scary as this might sound, it's important to remember that for many cancer patients, the benefits of these drugs outweigh the risks to the heart. Doctors are careful to monitor your heart during treatment and take steps to minimize any potential damage. Now, the next item on our list might surprise you. Number 4. Antifungal medication. Some antifungal medications used to treat infections like athlete's foot, ringworm, and yeast infections have been linked to heart muscle damage and even heart failure in rare cases. The most common culprits are the drugs itraconazole and fluconazole. Itraconazole seems to be the riskiest as it can weaken the heart muscle, making it harder for the heart to pump blood effectively. A 2001 review by Ahmed et al. That looked at the connection between itraconazole use and cardiotoxicity found 58 cases of heart failure likely caused by itraconazole use. The risk appears to be higher with doses over 400 milligrams per day. Fluconazole, which is a common topical antifungal medicine, has also been reported to cause heart muscle inflammation and damage in some cases. For both, the chances of heart problems are higher if you take high doses of these antifungals for a long time, especially if you already have heart disease. It is important to note, though, that most of these adverse effects have been noted in patients who take antifungal drugs orally. If you need to take one of these medications, let your doctor know if you have a history of heart failure or other heart problems. They can help weigh the risks and benefits for your situation. Next on the countdown is something many of you probably already take, and it's Number 3. Blood pressure medication. Did you know? Some medications used to treat high blood pressure could actually increase your risk of heart problems if you're not careful. One example is calcium channel blockers, like amlodipine and diltiazem. These meds help relax your blood vessels, but for some people they can cause fluid buildup and swelling, known as edema. In fact, a 2018 study in JAMA found that people taking calcium channel blockers were more likely to be prescribed diuretics or water pills later on, probably to treat the swelling caused by the first medication. Another group of blood pressure meds that can sometimes cause heart issues are central agonists, like clonidine. These drugs work by reducing signals from the brain that tighten blood vessels, but they can also mess with hormones like norepinephrine, which can stress your heart. The risk seems to be highest for people who are on several medications, but still have trouble controlling their blood pressure. If you notice any swelling in your legs or sudden weight gain after starting a new blood pressure medication, let your doctor know right away. They may need to adjust your treatment. Now let's move on to the next common medication, which many of you may already be taking. Number 2, diabetes medications. Some diabetes medications have been linked to an increased risk of heart disease. For example, thiazolidinediones, TZD, like pioglitazone, can cause fluid retention, which may lead to heart failure. In fact, a 2007 analysis published in diabetes journals found that people taking these drugs had about twice the risk of developing heart failure compared to those on other diabetes medications. Another group to watch out for are DPP-4 inhibitors, a newer class of diabetes drugs. While they are usually considered safe for the heart, a study found that users had a 27% higher risk of being hospitalized for heart failure. This risk was highest in people with kidney problems or a history of heart failure. These findings came from the SAVOR-TIMI 53 trial, published in the New England Journal of Medicine in 2013. Even metformin, one of the most common diabetes medications, can have issues, but mostly related to kidney health. This is usually only a problem if you already have heart failure or existing heart conditions. Just like with the other drugs on this list, the benefits of controlling diabetes often outweigh the possible side effects. But it's really important to let your doctor know if you have heart failure or kidney disease, so they can choose the safest medication for you. And now, for the number 1 drug on our countdown of the 6 common meds that can cause heart attacks. Number 1. Nonsteroidal anti-inflammatory drugs, NSAIDs. Did you know that many common pain relievers like ibuprofen, naproxen, and even prescription NSAIDs can increase your risk of heart attacks and strokes, even if you don't already have heart disease? The risk goes up the longer you use them, and at higher doses. A 2017 study found that most NSAIDs, except for naproxen, raised the chances of having a heart attack by 20 to 50%. Diclofenac had the highest risk, at 40%. And the scary part? The risk can start within the first few weeks of using an NSAID. If you need to take an NSAID, make sure to use the lowest dose that works for your pain and only take it for as short a time as possible. And remember, never take more than one kind of NSAID at the same time. If you have heart disease or risk factors like high blood pressure, let your doctor know. In many cases, acetaminophen or paracetamol are safer alternatives for pain relief. It might be surprising, even a little scary, to find out that some of the medications we rely on for pain relief or other health conditions can also raise our risk of heart problems, especially for those with cardiovascular issues. But this information shouldn't make you afraid to take the medications you need. Instead, use it to have an open conversation with your doctor about your concerns. Being informed and proactive about your health is always the best approach. So, take charge, stay informed, and remember, making heart-smart decisions is key to protecting your well-being. And there you have it, our video on the 6 common meds that can cause heart attacks. We hope you found this video both informative and helpful. If you enjoyed this video, please don't forget to give it a thumbs up, share it with friends, and subscribe to our channel for more educational content on health and wellness. Your support helps us continue creating valuable content and raising awareness about crucial health topics like medication safety and heart health. Now, we'd love to hear from you. Do you have any additional information about medications that can impact heart health? Or have you had personal experiences you'd like to share? Let us know in the comments below. Your insights and experiences are highly valued, and can provide great additional knowledge for our community. Remember, heart disease may be a leading cause of death worldwide, but by staying informed about the potential risks associated with common medications, you can be proactive in protecting your cardiovascular health. And if you'd like to show your appreciation, please consider sending us a super thanks. Every bit of support helps us continue to bring you content that matters. Thanks for watching, and we'll see you in the next video.